Hello, everybody. I hope you're all well. So today we are going to talk about endometriosis and pelvic pain connection. Okay. So let me introduce myself. I'm Ange or Anjali, and I'm women's health fitness coach and nutrition counselor. And of course, I'm the founder of this page. And today we have amazing guest, Phoebe, who is a specialist physiotherapist. Here she is. Okay, accept. All right. So before we, I think Phoebe is coming. So I'm going to read her bio. Hi, Phoebe.
Hello.
How are you?
Very good.
Welcome, welcome. So I was just about to read your bio. Okay, it's a very beautiful long bio. So
Oh,
okay,
you can
and
you can shorten it if you.
and then yes, be patient with my accent. Okay, so. Phoebe is a specialized physiotherapist in the areas of pelvic health. Hello, welcome everybody. And pediatrics with over 10 years working in pelvic health and pediatrics in the community and private sector. Phoebe holds a Bachelor of Science in Sports and Exercise from the University of Western Sydney, a Master of Physiotherapy from Sydney University, where she was awarded the what is this a scholarship? Do I say it right? Hoc Mai? Yeah,
Yes. Yes.
Hoc Mai Scholarship as well as Advanced Pelvic Health Training. That's amazing. Phoebe has specialized in pediatric physiotherapy through Monash University and has been a clinical educator for Griffith University. So Phoebe's special interests include childhood constipation and toileting. Oh, so handy. Oh my goodness, didn't I struggle with that one
Oh,
when my kids were little? Oh my goodness.
I think a lot of people
Yeah.
experience.
Oh, where's that other one go? Oh, oh my goodness, I wrote the other way around. Male and female bowel health, male and female pelvic health, and pre and postnatal care. Phoebe is founder and senior. Oh, Stacy here. Hi, Stacy.
Oh, Stacey. Oh,
I'm
I
like,
was
hi,
texting
Stacy.
her before.
And Phoebe is founder and senior physiotherapist at Pelvico Physiotherapy, previously known as Bump Fitness, right?
Yes.
And that provides pelvic physiotherapy to the Tweed, Gold Coast, Brisbane, Toowoomba, and Caboolture.
Yes.
Is that how I say it? Yeah. Awesome.
Yeah.
I think, that's awesome, Phoebe. And you have done and achieved so much. It's incredible. And before we start this conversation, we just wanted to say that this topic that we are talking is all about to bring awareness and educational purposes and general information, not a specific, advice for you. But if you have any questions, you can always participate in our Q&A session at the end, or we will put all the contact details for Phoebe in our content, right? So anything you would like to add before we start?
Yeah, I think you covered
You're
it
good.
all. Yeah.
I just
Sorry, that was a big mouthful.
no, sorry. I'm trying to be, like as thorough and enunciate my enunciation. My kid says you have to improve your enunciation, so I have to do I'm getting better. All right.
Well,
Okay.
I understand you clearly.
Oh,
Yeah.
thank you. Appreciate it. All right, so let's dive into what is one way you assist women in our community.
As you're saying, I'm a pelvic health physio.
Yes.
So we see all types of things around pelvic health for females. But one of the ways we do assist the women in the community is through pelvic pain, our management of pelvic pain, and endometriosis as well. So we see quite a bit of that.
Yes. So
Yeah.
so are the pelvic pain and endometriosis the same thing?
Um, they can be. So you can have endometriosis without having pelvic pain,
Mm.
and you can have pelvic pain without having endometriosis,
Mm.
and you can have them all together. So just having endometriosis isn't always the cause of the pelvic pain. So it's kind of, we have to do a bit of investigative work and
Mm.
figure out what's causing what. So yeah,
Yeah.
we become friends with our pelvic pain patients for a little while
Yes.
we kind of sort through all their concerns.
Yeah.
Yeah.
Because so you have to do the study before you say that this is, before you diagnose that this is the pelvic pain and this is the endometriosis. Before you say that, it could be any of them, right?
Yes. And
Yeah.
I mean, to formally diagnose endometriosis, they do need the surgery, the laparoscopy
Yeah.
and biopsy, which is an invasive
Mm.
um, way of diagnosing. So
Procedure, I guess. Yeah.
sometimes people don't want to go all that way. So we kind of treat it as endometriosis, and um, yeah, we just treat it kind of all the same way anyway, whether we've got the diagnosis or not.
Mm.
Yeah.
So you can't tell from the symptoms. You can't tell which one is which.
Not usually, no.
Mm.
So we, not from a physio point of view,
Yeah.
we can't. But regardless of the cause, the treatment is usually the same from a physio
Yeah.
point of view. Yeah.
Oh, okay. Yeah, because
Yeah.
it would be very hard to, because I wasn't sure if you could tell what, if the symptoms would be a little bit different to each other. So that's all.
Yeah, it's tricky because I mean, as a physio, I can't make the
Yeah.
endometriosis go away,
Mm, mm,
but
mm.
I can minimize the stuff that could impact it.
Yes.
So it might be bladder or bowels, or it might be,
Mm.
you know, how they respond to pain.
Yes.
So we would just treat those, and
Yes.
that can help to minimize, their pain
Yeah.
and
The
discomfort.
symptoms. Oh,
Yeah,
yes.
and obviously we'd be working with a team of people. It's not just me.
Yes.
So,
Absolutely.
there may be the gynae and the GP and
Mm.
dietitian,
Yeah.
acupuncturist, and
Yeah.
everyone. Yeah.
So they recommend people to you to minimize the,
Yes.
yeah,
Yes. Sort of like a team
team
approach.
effort.
Yeah.
Yes, yes. Of course, because
Yeah.
our body is so complex, right? So it's not just
Everything.
one
So,
thing.
yeah.
Yeah, especially
Yeah, definitely.
being a woman, we are so complex, beautifully complex.
Yes, exactly. Yes, and everything's intertwined.
Yes,
So,
yeah, it's like
yeah.
a double whammy. It's like not just the pelvic pain, but the endometriosis on top of it.
Yeah.
But that's why we have people like yourself, right, to figure it out and
Yeah.
help us.
Yes.
And that's
We
awesome.
try.
So, how long does it take for you and the team to diagnose this?
So the recent stats from Endometriosis Australia is that it takes 6.5 years
Wow.
for a diagnosis. So
Mm,
it was 7. So it's coming down, but very
mm,
slowly.
mm.
So there's definitely, I've seen in the last few years, more awareness,
Yes.
with all health practitioners about, and just the general public as well, about the condition. Yeah. So,
Mm.
but 6.5 years is still a long time to be living with a lot of
Yes.
pain and to be
Yes.
dismissed. So,
Yes.
yeah.
Yes. Absolutely. Yes. It's not like,
Mhm.
at least I think these days you don't get told that get married, have kids, and you'll be fine.
Yeah.
That is what I was told back home. Oh, you're a woman, so you just have a baby, you get married, you have a baby, and your pain will go away. I was like, okay, and I walked out.
Oh my God.
I was like, wow.
Yeah.
So yeah. So as a physiotherapist, how do you help people in this matter?
So yes, as you're saying, it's very complex,
Mm,
and it really depends on, what sort of treatment the late woman's had before. So they
yeah.
might have seen pelvic physio, they might have seen a range of people. So we kind of, we do have the gift of time in a pelvic physio appointment. So we do have 45 or 60 minutes for an initial, which is really, really quite nice, because then we can get a really good picture of what they've done in the past that's helped
Mm,
them, what hasn't helped. Um, and sort of build that rapport and that trust, because we are asking some quite intimate questions sometimes.
Yes.
So having that amount of time, is quite helpful in that way. So in terms of what we can do, definitely, help to explain pain pathways and chronic pain to them. That sometimes, if they've had their endometriosis removed, and they're still experiencing pain, then we can kind of go through why that is. And in terms of managing, their flare-ups and pain, we've got a range of tools. So, if a woman's come in and she's obviously in pain, or she says, it's a bad day, I might put a TENS machine
Mm-hmm.
on her. So around the pelvis, maybe the stomach or the low back. And there is some new research on around the perineum, so more closer to the vaginal tissues. Obviously not on top of it, but just to help manage those pain flare-ups. So a TENS machine is really good, and it's quite cost effective as well. So you can get them for about $40 now.
Mm.
Um, and so it is something good to just have at home anyway, because we use TENS machines for all types of pain, not
Okay.
just pelvic pain. So we can pop a TENS machine on.
Mm-hmm.
And the other thing is an interferential machine,
Mm-hmm.
that was typically used for pain
Mm-hmm.
in the past, and it also has a byproduct of helping the bowels as well. And so if anyone's had endometriosis or pelvic pain before, they'll know that pelvic pain and bowel issues go hand in hand. So
Ah,
the interferential is really good. It's
yeah.
similar to a TENS machine, but it's the waves go deeper
Okay.
um, into the abdomen. So you put the little sticky pads on their tummy and their back,
Mm-hmm.
um, and it helps to mobilize the bowels, but it also has some pain relieving features as well. Bit more expensive. That one's a $500 machine. So
Ah, okay. So
um,
the
yeah.
TENS machine, how does it work? Like, does it help to relieve the pain? How does it
Yeah.
work?
Yes, so it works on the sensory nerve, so it sort of scrambles the nerves,
Okay.
and so um, instead of their brain receiving the pain signal, it would
Yes.
receive the little pins and needles signal, so it can give their
Okay.
brain a little rest from receiving one sensory input to another. So
Okay.
it can just help to trick the brain, I guess.
Yes. So
Yeah,
lower the pain, but it's not. Yeah.
yeah.
Okay. All
So
right.
it's just a nice non-pharmacological way of pain relieving.
Ah,
Yeah,
okay.
so I have to
So
keep taking.
yeah. So the heat pad work. I wanted to ask because people uses the heat pads as well, right? But I don't know what.
Yeah.
Yeah.
So the heat pads, sort of the same thing. So your brain would receive the message of heat,
Mm.
um, but the heat pack also has a like a soothing effect for the muscles and a blood
Yeah.
flow.
Releasing.
Um,
Okay.
yeah.
Yeah.
I do find the girls that use heat packs heat it up a lot, and then sometimes they get tissue damage on their,
Oh.
if they're constantly using. It just depends on how they're using their heat
Mm.
pack, but
So
sometimes they heat it
they
up
have to.
way
Yeah. You have
too
to be
hot.
aware. Yes.
Yeah, yeah,
Yeah.
exactly.
You
Um,
said that you can buy the. Sorry, did I cut you off there?
no, no, no.
Yeah. No, you said you can buy the TENS machine at the pharmacy by yourself, pharmacy.
Yeah, pharmacy online.
Yeah, but
Uh,
they would
yeah.
have the instruction how to use it, hey?
Uh, Not specifically for pelvic pain.
Oh, okay.
Um, so uh, probably something that you'd need to see, like a healthcare,
Physiotherapist.
probably a physio,
So look
just
for
to show
help.
you, yeah, just
Yes,
to show you
yes.
where to put it on, and the settings, because you can choose different settings, and it does get quite confusing. And some people just turn everything right up, but
Mm. Oh,
um,
yes.
just turning up the hertz doesn't
Mm.
necessarily mean that you're going to be getting more
The
benefit.
relief.
Yeah, so there's been properly studied different setting
Mm.
for specifically for pelvic pain.
Yes.
Um,
Okay.
yeah,
No,
and
because
like
you
where to
said
put it.
with, yeah. because you said we can find it, we can buy it in the pharmacy. I was like, oh, then we can use it like a heat pad or some sort.
Oh,
But then, okay,
oh,
yeah,
yeah,
I
specific settings.
yes,
Yeah.
okay, okay, that
Yeah.
makes it clear.
Yeah.
Thanks. So, if anyone new here, just joined in. Yeah, so today we have amazing Phoebe, who is specialized physiotherapist. So we are having amazing conversation. Welcome. Thank you so much for joining us here. So the I wanted to ask, what's the next for endometriosis on a Gold Coast?
So there is PHN, so the Primary Health Network, are putting on an event for
Mm-hmm.
endometriosis for healthcare providers. I guess if you work in the endometriosis space, obviously definitely welcome. That will be November the 12th.
Okay.
I don't have the location yet, but I can send it to you.
Yeah. One
It's for
tips.
public knowledge.
Yeah.
Yeah. So I work with Dr. Natasha Gould. So she's the new women's health endometriosis GP working at the endometriosis clinic
Okay.
in Benoa.
Yeah.
I work with her and Dr. Loon, the colorectal surgeon, working with endometriosis as well. So they will both be presenting.
Mm-hmm.
Dr. Gould's got some new medications
Yeah.
specifically for pelvic pain.
Mm-hmm.
So she'll be presenting on them. So I'm excited to hear about them. I'll be presenting as well on physiotherapy management as well. So going into a little bit more detail about how we manage pelvic pain. So it's not just the TENS and the interventional. We'll manage bladder and bowel,
Yeah.
sexual function as well to make sure that everything's working well. So that's what's happening coming up. In November.
That's awesome.
Yeah, and
Yeah.
we've
So
also got your
excellent.
event as well.
Our event.
You've
Oh yeah.
got your event, yeah, on
Oh
Sunday.
yes.
Yeah.
Yes. On the 8th of September, everybody.
Yeah.
It's not many days to go on Sunday. Woo-hoo.
Yeah.
So Phoebe is
I'm
coming.
excited. I'll be there.
Oh yes, you better.
Yeah. Yeah. My
Yes.
husband's got the children and I'm going. Yeah.
Awesome. So I'm so excited. So, if anybody has questions, please comment down below. And while we're waiting, Phoebe, just let us know where we can find you or our community can find you.
So I work out of Benoa Medical Centre in the bowel diagnostics and endometriosis clinic.
Yeah.
I also do home visits as well, here and there where I have a space around
Wherever.
to be able to
Yes.
looking after my children as well.
Mm.
I also have another beautiful pelvic health physio, Courtney, who works out of the Tweed Super Clinic, AdMed Centres, Rabina, and also Bloom Physiotherapy and Bundle. So we're sort of
Yeah.
around the coast.
Hmm.
Um, and then I also travel out to Toowoomba and Caboolture and Brisbane as well. So
Fair
sort of
bit of
southeast
driving for you.
Queensland.
Mm.
Yes, we're here, there, and everywhere.
That's
Helping where we
awesome.
can. Yeah.
Yeah. So you're providing support to wherever you can, right? So,
Yeah,
yeah,
exactly.
that's awesome.
Yeah.
So, I wanted to ask one question. No one is asking questions, so I'm going to ask you a
Okay.
question. So,
Yeah.
so with the endometriosis, like you said, your pelvic pain might be intertwined, but could it be, and would you have exercises as well to support that? Or, like, or it's
Yes,
just
I really.
the medication and then the TENS machine and things like that?
No, it's definitely stretches and gentle mobility and stuff
Yeah,
to relieve some of the tension.
yeah,
Um, I find usually I would assess the bowels first, because they're, the biggest thing in the pelvis. And if they're not working properly, then they're going to put a lot of pressure and inflammation just in that area anyway. So I would definitely be addressing more bowel function and just making sure that that's working better, and bladder function too.
yeah,
Um, yeah, so more looking at how the pelvic floor is reacting to pain and whether that has an effect on opening the bladder and the bowels, and
mm,
working more on down training and functional bladder and bowel
yeah.
habits.
Yeah.
Yeah, rather than doing pelvic floor muscle training.
Exercise. Yes, yes.
Right, yeah,
Because
not
it's,
strength training.
yeah.
Yeah, yeah.
Because some of us might be tight down there.
Yeah, well,
My
that's the
husband
natural
said,
response. Yeah.
yeah. My husband said, tight is great, isn't it? I said, no.
Not always. Yeah,
Yes,
because it might become tight or just cautious because there is pain. So you kind of want to teach your pelvic floor and all the muscles around, your glutes and core and everything that,
yes,
it can just chill out and, um, you know, have a rest
yes,
rather than being on guard all the time.
yeah. No,
Yeah.
because, like, it's just when we think of it, like, like my husband, he didn't know that, we needed to relax as well as be able to tense
Yeah.
and be able to relax, right? Because he thought also, oh, tensing is all the time. It's great. But just educating and people and, like now he knows that I need to relax as well as the tense. And
Yeah. Oh, good
yeah,
on him. Yeah.
yeah.
Exactly.
No,
I mean, it's the same for men as well. Like men have pelvic pain and they walk around with tension all the time and they can have similar issues.
yes, yes, but we
Yeah.
will, yeah, we just don't know, right?
Yeah.
We just don't know
Yeah.
enough that we don't talk as much about the pelvic area, pelvic zone, that's like a non-talking area.
Yeah.
Yeah,
Yeah.
so we,
Exactly.
yeah, that's why we do what we do, right? To bring the
Yeah.
awareness in our
Exactly.
platform. So okay, so I think we are finished for our talk with our talk. And yes, would you like to add anything? Like you said that you have the primary health network event coming, and then yes, I will put all that in the in the content. Anything
Mhm.
else you would like to? Any advice for people?
Oh, I mean, if there is any issues, there's help out there,
Yeah.
and it doesn't matter how small, just go get it checked out. And if it's nothing, that's fine. But if it's something, then there's definitely a lot more help around
Yes.
at the moment. So,
Yeah.
yeah.
We just have to reach out, right?
Yeah, exactly.
Yeah.
Yeah, I'm happy to talk about all things bladder and bowels.
Awesome. That is,
Yeah,
yeah, that is
do it all
what
day,
you
every
special.
day. Yeah.
Yes, we know that. Awesome,
Yeah,
awesome, Phoebe. So,
yeah.
yeah, we say for now we say bye bye to you, and
Okay.
I'm looking forward to seeing you on the 8th of
Yeah,
September for on our event day.
yeah.
And yes, you have a great day.
Thank you, you too.
Yeah,
And
thank you
bye.
everyone
Bye,
for being
everyone.
here. Hey, yeah, thank you for your
See
support.
you.
Bye.
Bye.